Hi, I'm Dr. David Palmer from Align Corrective Chiropractic in Durban, and today's video is all about the disc and the problems it can cause. So what exactly is a disc? The disc is a soft gel-like structure that occurs between two vertebrae in your spine, and its job is to act like a shock absorber. The interesting thing about your disc is that it is an avascular structure, which means it doesn't have its own direct blood supply. It receives nutrition through a process called imbibition, which is a flow of fluid and nutrients into the disc through movement. So it is extremely important that your spine is aligned properly and that each joint can move appropriately. Misalignment of the spine leads to less movement. Less movement leads to less nutrients. Less nutrients creates wear and tear and weakness. And then something simple as bending over, twisting, sneezing can cause the disc to bulge. So if you have a disc bulge, it can put direct pressure on your nerve. Your nerves from your neck run down your arm, and your nerves from your lower back run down your leg. So a disc bulge can cause a variety of symptoms. Pain, tingling, numbness, sharp shooting pain, weakness can all be because of the nerve being compressed because of the disc. A disc bulge can cause severe pain, muscle spasms. What we have found is that most people go out and they take painkillers or muscle relaxants or get a massage, and this is all to help the muscles relax and to feel better, but it's not to fix the underlying problem, which is the disc. So if you have been struggling with this, what are your options to treat it naturally and conservatively? Well, step one, to address the flow of nutrients into the disc, we use spinal decompression therapy. To help the discs and nerves heal at a cellular level, we use class 4 laser. And to help the biomechanics of your spine and to take the load off those faulty discs, we follow corrective chiropractic care. We have seen over and over in practice how debilitating or crippling spinal disc injuries can be. But we want you to know there is hope. And it all starts with having a thorough assessment.